dog I want to talk about today is Good Buddy. So Good Buddy is owned by Daniel, and Daniel is one of the dog owners that walks by walking his dog every day. And much like in my community, I can't help but ask name and tell me about your dog. And he got his dog from a group of someone in his neighborhood who had too many dogs and needed a home for Good Buddy. And Good Buddy turned out to be part pitbull, I think, but is just the best dog. I mean, you cannot find a happier dog that loves to chase a ball right out into the ocean. If you don't have a ball, he'll just chase the waves. It's just, and that happy, beautiful smile on that dog is totally from the first day that dog and owner walked down the beach, the owner has this beautiful smile on his face, and so does the dog. It's a perfect match. And a couple of times we had Sunday ham, and we saved the ham bone to give to Good Buddy, just as a way to say we really enjoy watching your dog fetch the waves, and just appreciate your beautiful dog. This went on for a couple of weeks, and then one day Buddy was out playing fetch, and he's about 4 years old, and he started to limp. His front shoulder began to limp. And as you can see in that picture, he's pretty healthy. He's not overweight. His muscles look well developed. And if you could give any credit for demeanor, that is a happy, healthy dog. But his owner Daniel thought, oh, it'll pass. It's no big deal. And I said, if it continues, put some ice on it. It's really good for inflammation. And the next couple of days, we don't see Good Buddy. And so about 4 days later, we see Good Buddy, and we go out to talk and say, how's he doing? And he's like, the first day we've let him walk in, run up and down the beach for the better part of a week, like 5 or 6 days by now. And he goes, he's limping a little bit, but as soon as Good Buddy started to chase after those waves, you could start to see that he didn't limp when he's chasing the wave, because he's got that mindset of a dog where he's just focused on catching the wave, I guess. But then as he would come back, it definitely was inflamed. So I ask Daniel, what are you going to do about it? And he's like, I took him in a few days ago to the veterinarian when he wasn't, it'd been 3 days since he was still limping, spent $600 on an x-ray. And the $600 x-ray said there's nothing broken, it's just a sprain, but so rest it, and we'll see how he does. And of course, right after he starts limping again, Daniel shared that, the doctor said if the dog runs again and it's still inflamed after you rest it for a good week, we might have to send you to an orthopedic dog doctor and see what a surgery might do. At which point, the hairs on the back of my neck spring up, because this is a very common parallel to what happens to our human bodies. And I do think that pets do a really good job of showing you what happens inside an internal medicine clinic, which is we look at the long game. We look at what happens to people when they have injuries or life that really does inflame their body and age their body. And then once one little thing starts to give them symptoms, it's almost a canary in the cave for showing you what happens with the other parts of their body. So yes, Good Buddy, beautiful little dog. And of course, you can't be watching this without knowing that I'm probably going to mention the ketogenic diet. So I asked Daniel, well, what is that injury? That injury is an acute injury. It has inflammation in it, much like my sunburn is an acute injury, and maybe the tender muscles from that really deep tissue massage are also acute inflammation. That should go away. I ice my shoulders. I told Good Buddy's owner to ice his shoulder. That's kind of hard on a dog, but you can do it. The other thing to do in an acute injury, acute inflammation, is to rest it. But now it's been 3 weeks since Good Buddy's injury, and he's still limping. So we call that the acute on chronic. inflammation. He started out with a single injury, but there's something deeper going on inside Good Buddy's body that's making it difficult for this healthy being to reverse the inflammation. So chronic inflammation is where you think of a flame, and that makes you almost think of the opposite is water, right? Water and fire are opposites, right? But chronic inflammation inside a human body, it is heat. Like my sunburn has heat. The muscles, even without the sunburn, are tender and they have warmth. Good Buddy's shoulder, although you couldn't feel it when you touched it, if you really got technical, you could see that there was more heat coming out of his shoulder. So that heat also is associated with a higher recruitment of fluid, of inflammation. So fire and water actually go the same in chronic inflammation, that there's a chronic warmth and there's inflammation inside that joint. Now pretend this is our dog, but this is what happens with patients as they have little injuries. They come in to get an antidote from the clinic, and we say, that does teach me that there is something deeper going on inside your system. So as I look at that, what my brain is thinking of, what I wish the patient could imagine with me, is what their mitochondria is doing. So this is my favorite, most beautiful picture of a mitochondria. As you look at that mitochondria, you can see that it's the powerhouse of our cells. Most cells have dozens, hundreds of these in them, and it is where the energy of life comes from. The fuel happens inside that inner membrane. That's that beautiful lace work inside there. And as you look at glucose going through a cell, it produces actually a very hot, quick energy. And that doesn't really help out, although it provides energy, and you got to have energy to live. It doesn't repair or reduce the inflammation when a mitochondria uses glucose. Instead, if we could get Good Buddy's mitochondria to use ketones, we know that the longer those ketones recruit into the area, the more that we could flush out a water removal. So the first thing I ask Good Buddy's owner is, well, what do you feed him? And he said, I feed him the best diet at the food store. And I don't know if he said kibble, but I think it's a good demonstration from this chart where if there's a calculated delivery of food that's very stable, it's when you buy a 50-pound bag of food and you feed it to the dog. It really does stay stable. In fact, when we gave Good Buddy that bone to chew on, he's like, oh my goodness, he hasn't chewed on one of these since he was a puppy. And obviously he says what Good Buddy really does with it is he goes and buries it in the yard. So I don't actually know that he ate it. But I want you to take a look at the percentage of carbohydrates in that kibble versus the percentage of carbohydrates in a ketogenic diet. And then I want you to look at the difference between what the blood glucose, the average blood glucose. So this is like putting a continuous glucose monitor into the cells or into the tissue and watching to see what does their average glucose do when they were on a kibble diet versus on a ketogenic diet. And of course, folks on this channel know that this is not a high protein diet. It is a moderate protein with a very high fat diet and a low carbohydrate diet. When I'm looking at the types of improvement that you can have in a ketogenic diet, it really is a metabolism driven process where you're not just changing the food because that's where all the answers are. You're changing a food to impact the science, to impact the chemistry deep inside those cells. And as much as you'll see me check my numbers every week on this show, for a dog or for most newbies, I really enjoy that they can check urine ketones. Super easy, cheap, safe, and just like humans, you can measure that urine ketones by running that. I used to have a girlfriend in medical school who had a dog with diabetes, and she would check for urine glucose every time her dog would pee. And so we got really good at swiping the urine midstream with the urine glucose strip. And you can do the same thing with a ketone strip. Again, cheap, easy, safe, and you don't need a doctor's help to set that up. So when you look at the moment on the beach, I'm telling Daniel, Good Buddy's owner, to say, all right, you really need to decrease inflammation before you let that orthopedic surgeon open up this beautiful dog who is healthy, who has, at the very early onset of an injury, turning into a chronic injury, this is the time to reverse it. And by slicing open that dog, scraping out whatever that surgeon's going to scrape out, and sewing back together, the damage you're going to do in that setting, it doesn't mean it's never going to be needed, but for heaven's sakes, 4 weeks into this injury, please, please give this dog a chance of being on a ketogenic diet for 6 weeks. I said, if it's a chronic injury that you're going to need surgery for, it's still going to be there in 6 weeks. So I gifted him a copy of Any Way You Can to listen to, and said, there's some dangers when you do first start a dog on a ketogenic diet. You're going to take away that dog food. You're going to get some organ meat. You're going to have high-fat, really satiating, really good food for Good Buddy. And he's probably going to get diarrhea. So you're going to want to stay near, keep him outside, or really respect when he starts to whine that he needs to scooch outside, or you're going to have a mess to clean up. So the next question that Good Buddy's owner asked me was, well, do I have to do this forever? Is this just a fad thing that I do until his shoulder feels better? And I said, you could do that. You could get him feeling better and then go back to that way of living, but I would warn you. And this is why it's so important that I continue to show you I am in ketosis for life. This is what I think the healthiest way to age your brain is. I don't do this myself because it's easy. I do this because day in and day out in an internal medicine clinic, much like what your visions will be when you watch your pet's age, I've watched patients age, and I don't want that. I really, really do not want the danger of chronic inflammation to seep into my body or into my brain. And I said, if Good Buddy's only 4 years old, and we were here watching him when he had that injury, he didn't get hit by a car. It wasn't a super traumatic injury. It was a tweak that started with a little inflammation, and that little inflammation grew. And 4 weeks later, whatever it was that he was resting, didn't move, comes back to the beach, and within 15 minutes of running, doing his natural, reflexive, chase the waves, this is the happy dog we know, his limp is back. So I want you to take that seriously, to say, if you look at why we take down that inflammation and we sweep it away, we get that flame, we get that fire and water out of Good Buddy's joint. And then it gets to reset. I like to think of it, it gets the slime layers nice and oiled up again, and he can go back to running and it doesn't come back. But isn't it a warning that the slightest of injuries cause him to have chronic inflammation? So if that happened already at the age of 4 for this beautiful, healthy dog, what will happen when he gets the next injury and the next injury? And wouldn't it be better if he lived with those high ketones in place to prevent those oxidative stresses, to prevent that electrons that are doing naughty things, to be the antioxidant as a way to prevent acute inflammation from leading to chronic inflammation? And when people say, wow, you're going to do this keto thing for the rest of your life, I'm like, absolutely. Absolutely. Mainly because I have a mother who had cancer of white blood cells. And do we know that that's genetic? No. But do we know it's related to chronic inflammation? Yes. And I want to have the best functioning brain until the day I die. And what's the way I can guarantee the best chances of that? Is to keep the inflammation low on the deepest measuring part, which is that mitochondria and that cell.
Please subscribe to my channel. And don't forget to click the notification bell so you don't miss out on any new videos. Stay tuned.